Hello, my name is Ariel Alba. The title of my quality improvement project is Enhancing Patient Skin Integrity in the ICU by Implementing Interdisciplinary Measures and EHR Strategies, a quality improvement study. My presentation is about reducing pressure injuries in the ICU setting. Pressure injury is described as damage to the skin and tissue which is caused by pressure and/or shear, usually found over bony prominences. Populations at risk are those who are immobile, such as those on ventilators, or those with decreased mobility, such as stroke patients with physical deficits, and those who are connected to many wires and/or tubes, like chest tubes, IVs, and Swan-Ganz catheters. Other risk factors include patients with low hemoglobin and low albumin. There are current measures in place, one of them being the Braden scale. This is something that is currently charted by nurses in the ICU, but there are not any required interventions attached to this score charting. It simply presents a number and there aren't specific interventions or directions to follow based on the scores charted. This project surrounds the Braden scale and modifications that can be made to improve this process. Many nurses, however, they do include these other measures like foam dressings, turn schedules, and 4-eyes assessments, but it isn't attached to any score. Usually the charting is done just based on the nurse's clinical judgment for skin integrity. This project is designed to reorganize the current methods in place. This problem is significant because it not only impacts the healthcare system, but the lives of each patient who develops a pressure injury. Pressure injuries put patients at greater risk for infection. This is especially important for patients with comorbidities such as diabetes. Pressure injuries increase hospital stays by 2.6 days, contributing to nearly 60,000 deaths that occur every year. The cost is $11 billion every year, and pressure injuries increase morbidity and mortality. I will be using a local hospital as the setting for my quality improvement project. The local hospital that I'm using is an acute care hospital. The average number of adult admissions in 2023 was 16,585. 2,970 of those admissions were ICU admissions. There are a total of 306 beds, with 45 being ICU beds. There's a medical ICU with 25 beds and a surgical ICU with 20 beds. The purpose of this study is to evaluate the effectiveness of electronic health record alerts based on Braden scale scores and the associated interventions that follow on pressure injury prevention. It's also to evaluate the effectiveness of secondary skin assessments on severe high-risk patients based on Braden scale scores by wound care specialists, and to decrease hospital costs and improve patient outcomes. Project questions include: do secondary skin assessments by the wound care team for severe high-risk patients based on the Braden scale score reduce the likelihood of hospital-acquired pressure injuries? And does implementing EHR alerts improve compliance with pressure injury prevention strategies, thus leading to reduced incidence of pressure injuries and overall healthcare costs? Project objectives include: assess the impact of the interventions on the prevalence of hospital-acquired pressure injuries over 6 months, increase compliance with interventions aimed at preventing pressure injuries, enhance collaboration between interdisciplinary teams in the prevention of pressure injuries, and introduce EHR alerts for the documentation of interventions based on the Braden scale score that is charted. The review of literature that relates to this project includes several factors, such as the prevalence of pressure injuries, the limitations in the Braden scale, the effective communication and collaboration between interdisciplinary teams in the prevention of pressure injuries, the importance of documentation and the effectiveness of alerts in the electronic health record, and the effectiveness of turning schedules. My personal favorite is the review on the Braden scale because this project aims to modify the use of this scale, and in turn, those modifications will address the limitations that are stated in this study. The strengths and gaps in the literature review include: strong evidence suggests that compliance and teamwork between interdisciplinary teams can reduce the incidence of pressure injuries. As far as the gaps, the Braden scale is effective in assessing the risk of developing a pressure injury, but it needs modification. Research on the effectiveness of turning schedules is mixed because blind studies could not be completed due to performance bias. The methods for the project design includes a pre- and post-intervention study. The model used is the Plan, Do, Study, Act model, which will include 2 cycles. The first cycle is like a trial run, and the secondary cycle will include any modifications needed that are noticed from the first cycle. For the plan, I will include the proposed changes in nursing huddles as well as in meetings between each participating interdisciplinary team, such as wound care specialists and doctors. Educate each team on the Braden scale and modify changes, including upcoming changes to the EHR. For the Do, implement EHR changes. Implement rounds by wound care team for severe high-risk patients based on Braden scale scores. So the EHR changes will be what prompts the rounds by wound care specialists. I will include more on that in later slides. For the study, we will evaluate charting by nurses and notes by wound care specialists to determine the effectiveness and compliance. For ACT, present results and offer the participants a chance to offer feedback through a post-intervention survey. And then the PDSA cycle 2 will follow. So for the methods and setting and participants, project setting will be a 20-bed surgical ICU and a 25-bed medical ICU. The participants will include all assigned nurses and wound care specialists. For the intervention, this is the important part, the Braden scale score must be charted each shift. An alert will pop up if the patient's scores are considered high risk or severe high risk. The pop-up will prompt the nurse to chart interventions done to prevent a pressure injury. A wound care consult is then automatically sent for patients who score as severe high risk on the Braden scale first time it is charted. This pop-up will be similar to a Muse score alert, which also prompts the charting of interventions, or similar to like a sepsis alert. Interventions to be documented will be reviewed on the next slide. So the daily skin assessments for severe high-risk patients will be done by wound care specialists. And after the nurse clears the pop-up with the required charting, the wound care specialist must assess the patient at least one time within 12 hours of the consult. The specialist can then determine if the daily assessment should be continued or if there are other interventions that can be done by the nursing staff. A note must follow this assessment. For recruitment, the plan included in the nursing huddles in each ICU plan is emailed to all participants, and a HealthStream education video will be added and required to be finished by each participant before implementation of the project. For data collection, these measures include documented skin assessments by wound care specialists on patients who have been marked as severe high risk by the Braden scale, documentation by nurses, which include the Braden scale scores and interventions for those scores that popped alerts in the EHR. The documentation of these interventions can include a 2-hour turn schedule, use of foam dressings over bony prominences, use of pillows and wedges for repositioning, floating heel boots, and nursing notes. Also skin assessments to be charted by nurses for patients who score low to high risk, and then also skin assessments to be charted by nurses and wound care specialists for patients who score severe high risk. Continued data collection includes the pre-intervention data collection, which will be the number of reported pressure injuries and compliance among nurses determined by documentation. And then post-intervention data collection will include the percent of pressure injuries 6 months after implementation of the project, percent of compliance among participants determined by charting of the Braden scale and interventions after alert pop-ups in the EHR. For data analysis, we will compare data from pre-intervention to post-intervention, including percentage difference or pressure injuries reported, percentage of charting compliance. We'll also analyze the percentage of assessment compliance by wound care specialists who are assigned patients based on Braden scale scores. For ethical considerations, we will include education. Education will be given to all participating staff before the project is launched. All information regarding the project will be included in huddle notes and in each participant's email. Education will be given to the patient or their families regarding the importance of skin integrity and what we will do to ensure their safety. Consent, since this project aims to improve patient care and due to the critical condition of ICU patients, consent will only be obtained by those patients who are able to consent. When it comes to patient safety, consent is only obtained to help maintain patient autonomy. This will also be after education is given on the importance of maintaining skin integrity. There are several implications for this project. For nursing practice, improve compliance with charting and use of pressure injury preventative measures. EHR alerts act as reminders and help the nurses know what measures are appropriate for each patient, similar to sepsis alerts, Muse scores, and fall scores. Complete charting and compliance helps to protect the patient's skin and the nurse should any injury lead to litigation. I will circle back to this point because it is so important. Wound care, secondary assessments by wound care for severe high-risk patients to ensure another measure is in place to help prevent pressure injuries. The wound care team can be used as a prevention and treatment versus only treatment. And then policy. If the results of the project are positive, hospital policy changes should be made to include the changes made during the project. So complete charting and compliance helps to protect the patient's skin and the nurse should any injury lead to litigation. This is such an important factor that I believe should be included in the education for all participating staff because some nurses may see this project as something that may increase their workload, but in reality, the addition of wound care specialists is meant to alleviate some workload, and the few minutes it takes to chart and implement interventions can protect the nurse and the patient. One of my old managers used to say, if it's not charted, it didn't happen. Charting is so important and it should be seen as a protective measure for nurses while the interventions done are protective measures for the patient. Thank you for taking the time to listen to my presentation. Here are the references used for my project. Again, thank you for listening to my presentation. Have a wonderful day.